Hi all, and thank you so much for joining us today for a Q&A discussion on the coronavirus pandemic and what we can expect in the next few months. My name is Alex Hendricks. I'm a reporter at the Sacramento Bee's Equity Lab, which is hosting the panel discussion today. Events like this would not be possible without the support of our subscribers and readers. You can support events like this by subscribing to the Sacramento Bee at sacbee.com/subscribe. You can also subscribe to the Equity Lab's free newsletter at sacbee.com/equitylab-newsletter. For those watching at home, feel free to submit your questions on Facebook, and if we have time at the end, we will ask those questions to our panelists. It's been just over a year since the stay-at-home restrictions fundamentally reshaped our lives. Since then, hundreds of thousands have gotten sick in the United States, and too many have passed away. Thousands are struggling to find a job, make rent payments, or help their kids through online schooling. The last few months have been a whirlwind of new, evolving information. The distribution of vaccines offers a potential bright spot for what's to come. I'm joined today by 4 local health experts and advocates who will help us today make sense of what's happened over the last few months and answer questions readers have submitted on what's to come next. These panelists have a wealth of knowledge to share with us. They are professionals who are tracking the virus, delivering tests and shots, and analyzing new research and recommendations. I'd like to introduce them now. Dr. FLOJAUNE COFER is an epidemiologist and senior director of policy at Public Health Advocates. Dr. LORENA GARCIA is associate professor of epidemiology in the UC Davis Department of Public Health Sciences. Khadija Soufi is the vaccine clinic director at Shifa Community Clinic, a student-run free clinic for Sacramento's underserved populations. And SHANTE Williams is a community center program manager at Mutual Assistance Network, overseeing a COVID-19 test site in Del Paso Heights. Thank you so much, all of you, for making time to speak with us. So I will jump right in because we have lots of questions. Many readers ask variations of this question: when will age-based vaccine prioritization begin? And Margot Robinson of Sacramento asked this specifically. The process to find vaccine appointments is extremely difficult, especially for vulnerable populations like the elderly. Vaccination efforts are decentralized. Finding available appointments and locations often requires tech savviness. How do we improve this process to ensure that vulnerable populations aren't being left behind? And today, the county released new data showing that neighborhoods hardest hit by COVID-19 have the lowest rates of vaccination, while areas like Land Park and Fair Oaks have some of the highest rates of vaccination. I'd like to start with Khadija. You're working on the ground, actually getting doses and distributing them. Can you tell us a little bit about what you're seeing? Are supplies ramping up? When might more folks be able to get doses? And how are we ensuring that vulnerable populations aren't being left behind?
I mean, that is a really big question and something we've thought about a lot through our clinic. Initially, we were releasing appointments online and people would sign up, but we noticed that we were getting a lot of phone calls from people who didn't necessarily know how to use online platforms to register for appointments. We actually started reserving slots. And for those patients, we would call them on our own, make sure we were able to reach them. But it was also like a lot of time on our part, and it is a huge commitment. And it is something that's been part of the greater conversation in UC Davis. And I know recently today, they expanded the slots so that every patient who has been to the ER will be able to get vaccinated through UC Davis in the future. And in terms of when people will be able to get vaccinated and age-based criteria is going to start coming out, we have expanded a lot in the last month. And I think in the next month or so, it seems like we will be opening up more groups.
Thank you so much for answering that. I'd also like to get Dr. Cofer's thoughts on this. Specifically the new data sort of confirming what we all sort of suspected, which was that the lowest vaccination rates were going to be in neighborhoods most impacted by COVID-19. And I'm wondering if you could sort of untangle that trend for us.
Well, a lot of what you have already highlighted, right, as some of the challenges are part of the reason why that's happening. You have to be pretty tech savvy to be able to identify, how to sign up for vaccine appointments. They go pretty quickly. And so often our communities that have been hardest hit by COVID and our communities that are lower income or have less access or where English is not the primary language, it means that that's a barrier to being able to go in and figuring out and knowing exactly what's happening. It means that if you're not on social social media or on, an email distribution list, you're not getting the real-time notifications of what's changing. And so that is really one of the reasons why. So, I joked and said that this is sort of the water is wet headline, because we know based on how it's rolled out that of course it hasn't been equitable. Right now we do have eligibility for people who are over the age of 65, but everybody else is not age qualified in. So I just wanted to make sure that we clarify that, and that we're opening up new tiers as the weeks move on. There is a phone number for people to call so that everything isn't housed on the website, and that's 916-875-2400 to be able to call if you have COVID vaccination questions. And that's also a place where you can get navigation help to be able to identify where vaccine clinics are happening and how to make appointments for people who are not tech savvy. The challenge, of course, is, and this is the same is true statewide, is that the phone number is listed on the website. And so you almost have to have internet in order to be able to find out what the phone number is. And so those are the challenges that we're up against, and part of the reason why we're not seeing the higher vaccination rates in some of the communities that most need and to counter a dominant narrative actually want vaccine as well.
Mm-hmm. Mm-hmm. Yeah, absolutely. Thank you for sharing that. And that number, I might ask you to repeat that number again at the end of the session. I'd like to jump into the next question we got. This is from Tracy King in Fairfield, who asked, when can we be around others without wearing a mask? Dr. Garcia, you're on the front lines watching this virus and latest research. I'm wondering if you could answer that question.
Well, I think it's really exciting because we just heard today from the Department of Health that the age beginning April 1st, vaccines will be available for individuals over the age of 50. And mid-April, we should see that available also for young individuals, teens and young adults. So it's safe to be around others once you've received, for example, if you have the Pfizer or Moderna, the second dose, and 2 weeks after that. Now, if you have the Johnson & Johnson, that would be 2 weeks after that single dose. And being around individuals that had also been vaccinated really offers us an opportunity to be around our family, our friends, our neighbors that are also vaccinated, or our social bubbles, our other family members that we meet with as well.
Great. And the next couple of questions are directly related to that. So we've got a question from Yvonne Calderon in Sacramento, who asked, do you think getting vaccinated for COVID this year will become routine like the flu shot given once a year from now on? And Azucena Jimenez asked a related question, which is, how would you persuade individuals who do not regularly receive vaccines to obtain a COVID-19 vaccine? Maybe Dr. COFER, you can answer this or share your thoughts on these questions.
Sure. So first and foremost, we don't know. And I think it's really important for us to say the things we don't know yet. The virus is only, a little over a year old in terms of it only had a name on February 11th of 2020. So we are learning a lot as we go. And so we don't know yet whether we will need booster shots and how long the immunity will last. So that is one of the outstanding questions. Thus far, it does seem to be, more than the initial few months, but we're waiting to see. So the question of boosters is one that remains to be answered. In terms of how we would convince people to get vaccines, I would actually say that we shouldn't, because I think when we approach people sort of in that, and I hate to malign an entire industry, but the used car salesman kind of way, which is, get this, you should do it, come on. I think you actually make people more reticent to follow along because they feel like there's something you're leaving out. And so what I would encourage, and I strongly encourage people to do, is to be really honest. That's why I like to say, I don't know. There are things that we don't know yet. And because these vaccines are under an emergency use authorization. And so there are things we don't know. That doesn't mean that there's not safety associated with them. That doesn't mean that people should not be able to have access to them and that they're not going to do good. But I think when we're honest, it actually helps people to feel more comfortable taking a vaccine. So some of the questions that have come up are, well, if I'm healthy and I think I'm going to be okay, why would I take the vaccine? And the answer to that is that, people who are vaccinated have not been hospitalized or died from COVID. So that's a big thing, right? Nobody who has been vaccinated has been hospitalized or died from COVID. That's huge, especially when we're looking at, over 500,000 people having died from this, and many more becoming sick in ways, again, we don't know what the long-term impact is. And the hospitalizations have pretty devastating impact for quite a long time for many of the people who are impacted. So I think answering questions, there are some people who are concerned that they can't afford the vaccine, and reminding people that it's free, right? Some of those are the barriers. And so I think the more we can remain curious and say more about what your concerns may be. Can I answer your questions? Yes, we've been studying, severe acute respiratory syndromes, which is what COVID-19 is, for the last almost 20 years. So the vaccine production was fast, but the research that is supporting it is actually been going on for almost 20 years. And so some of those, as we answer those questions, people become more comfortable. But I also think that we should tell people how to stay safe if they're not yet comfortable. And I want to just take a step back and remind everybody that if this weren't a deadly pandemic, none of us would have access to this vaccine yet, because it would still be in clinical trials. And so I don't want us to be in a position where we're shaming or telling people that they're wrong for feeling a sense of hesitancy, because usually none of us, except for those who were in the clinical trial, would have access yet. And so for some people, they want to wait a little longer, and we should be also talking about harm reduction and really making sure that when the time comes, people have enough information and they feel comfortable so they can opt in.
Thank you so much for sharing that. I don't know if anyone else wanted to add to that conversation.
I can answer that a little bit. I think being part of SHIFA, a lot of people have come in and they've had questions about the vaccine. And I would just really encourage everybody, if you have questions to the vaccine, go to a vaccination center, talk to your medical provider, talk to people who actually know what the vaccine is, what it has in it, and would be able to answer your questions directly. I think I've had a couple of people come in and ask me questions or bring up concerns that weren't necessarily based in any of the scientific research or any of our understanding of the vaccine. So I would just strongly encourage people to know that when you go to the vaccination center, you can talk to anyone there. They're responsible for counseling you, giving you advice. They have medical directors and medical providers to answer any questions you may have.
I guess one thing that we just to quickly follow up on, would you maybe recommend someone, maybe they're nervous, but have them sign up for an appointment, and then when they get to the clinic to actually get their shot, then they can ask all the questions that they have then, right? Sort of getting as many people in the door as possible is really a priority right now.
Yeah, I'd agree. I think a lot of people should sign up for appointments, and if they have the concerns, they can always ask the people there, and they are more than happy to help answer any questions, help comfort people. I mean, there's a lot of people who are nervous from the shot, but I've administered vaccines for over 4 weeks, and it's for most people, they barely feel it. It is a really small needle. It is a really quick process. I think the hardest thing is just, it is a vaccine. It is a stab in the arm. Some people are nervous about that, but we are here to support you 100%.
Mm-hmm. I'd love to pass on to SHANTE, if you can add a little bit to this as well.
Yes, I think when it comes also to registering and then asking questions, really getting that information prior to your appointment, because unfortunately with these vaccines that if someone changes their mind or not, they're not able to hold on to those vaccines very long. And so sometimes if we don't use it, you lose it and we waste it. And I know that's a concern already about the number of vaccines. So I would suggest that people get the education, talk to your medical provider in advance, answer some of the questions are on Sac County's websites, and look at those answers first before scheduling your appointment. That kind of will give you an idea of what you're about to walk into prior to making your appointment, because sometimes those appointments go really fast. And if you schedule and don't go, it could be complicated for someone who had an opportunity and didn't get it.
Thank you for sharing that. And Dr. Garcia?
I completely agree, and I concur with all of the panelists, in particular with Dr. COFER. I think it's important for us to be mindful and respectful of community members and understand that it's just that hesitancy. And that's a logical, rational response, right? To see what's going to happen once someone has the vaccine. So maybe speaking to family members, community members, community-based organizations are key, community health workers, churches, faith leaders, those are important individuals as well. So speaking to someone that you trust and you know, and asking them about their experience with the vaccine, I think is very important and shouldn't be underestimated.
Absolutely. Thank you all for that. That was great. Our next question is from Dorsey Griffith in Sacramento. They asked, what do panel members expect will be the long-term effects of the virus and everything that came with it on communities of color? I would love to direct this question first to SHANTE. Anyone can jump in afterwards as well. But SHANTE, you work in one of the neighborhoods most impacted by COVID-19 this year. Can you just share a little bit about what you're seeing? Who's getting tested? Who may struggle the most to recover from the economic and health impacts of the pandemic?
Yes, definitely. When it comes to who, the community that I serve in, we have a very diverse neighborhood. And in that, having that very diverse neighborhood, we see the turnaround of some of our Black and brown families that have a lot of the highest rates of positive results coming back. And so when we look at the health, we're looking at some of the health aspects that come along with some of our families and the relatives. So we also look at what's resident. You have diabetes, high blood pressure, things of that nature. What are we doing to support them? How are we helping them? But then we're also educating them, right? Because when we talk to our families that are in the communities that want to get tested or maybe don't want to get tested for a certain reason, we want to ask that question, why, right? We want to share with them what the numbers look like for, your ethnicity, so that way you're understanding that it's really important for that ethnicity to be in the know. A lot of people don't know, and so because they don't know, they don't do. And so really being able to spread the message and the education, and also providing educational tools for them to get those immediate answers. Just me walking and telling someone you should do it is not going to help them. They need to know for themselves. And so doing a lot of that research and outreaching in the communities to spread the education is one of the first steps that we can do for the families that we're serving.
Thank you for that. I don't know if others had thoughts they'd also like to add. Again, the question was, what do panel members expect will be the long-term effects of the virus and everything that came with it on communities of color?
I can jump in here. I mean, one of the challenges, of course, has been that, this was layered on top of systemic racism. This was layered on top of, the ways in which communities have been disinvested or have been actively antagonized for generations. And so, a global pandemic doesn't make that better. It makes all of those conditions worse. And so what we have seen is just the way that what we typically in public health call social determinants of health have really been harmed in addition to our physical health because of the increased risk for COVID-19. And so we're talking about people's housing being destabilized, or people not being able to afford, the things that they need in their lives because they've lost jobs or wages, mental health being exacerbated because people are now dealing with the stressors of having to educate their children or care for elderly relatives. I mean, the unspoken, I think, sometimes toll of having somebody who was hospitalized, who was put on a ventilator and now needs long-term care, because we keep saying ventilator, but ventilator is life support. And so you've had a family member who is nearing the brink of death survive and now needs long-term rehabilitation care, and you're already at home taking care of other family members and trying to work and do all of these things. That takes a real toll on our families. And so as much attention as there has been already on the vaccine development and do people feel comfortable and safe, I think we also have to talk about the fact that there's so much in the treatment and understanding of just what this virus does to us in the short and long term that we are literally learning every single week. New papers are coming out, new things we're discovering about what the impact is going to be. And so I think in some ways we've scrutinized the vaccine, and don't get me wrong, rightly so, but a lot more than we've scrutinized some of the treatments you get when you're in the hospital, and some of just the long-term effects of what it means to actually contract this virus. And so those are all now going to be layered on top of the people who were most likely to get the virus, which are communities that were already, systematically having been marginalized.
Mm-hmm, mm-hmm. And Dr. Garcia, I was wondering maybe you could add to this as well.
Absolutely. And one of the other things that we have to think about are the other epidemics that impact these under-resourced and underserved communities that have been ongoing, such as type 2 diabetes, hypertension, obesity. So these are, health outcomes that are preventable. And I'm, optimistic with the American Rescue Plan that hopefully, with the 2.25 million dedicated to reaching these communities that ultimately truly need all of these resources and this investment long term over a long period of time, I think will make an impact. And putting money into community-based organizations, community health workers, I think is critical.
Thank you so much for sharing that. And just to echo what you all are saying, I've been trying to be mindful of not, avoiding the phrase like end of the pandemic, simply because this sort of end of the pandemic doesn't just sort of happen overnight. It's sort of an ongoing and evolving evolution of the epidemic or of the pandemic. I'd want to transition though to a question we frequently got from people, which is, what will summer look like? Especially since last summer, we saw at the time was a peak of COVID cases happening then. Things are different now, obviously, but several readers, for example, asked when they can expect large venue events like concerts to begin again. And Kathy Higawara in Roseville said she's concerned that variants spreading might make some activities unsafe. One thing I am often hearing from health experts is that nothing is 100% safe when it comes to COVID. It's simply about the statistics of what is safer. I'd like to ask y'all, what would a safer summer look like this year? What should people plan for? I know this is kind of like a maybe difficult question to ask, but I'm wondering maybe what you sort of foresee as the next few months. How will the next few months look like? Maybe we could start with Dr. COFER, and answer it to your however you're most comfortable. I know it's a difficult question to sort of speculate, but it's something that people are asking a lot. So how would you answer this kind of question?
I would say that, as more people are able to access the vaccine, there will feel like a slight, sort of alleviation of the pressure, right? As families and social groups are fully vaccinated, the CDC recommendations do allow, or the guidance does allow for people to gather together in small groups of fully vaccinated people without having to wear masks. And so that will give people the feeling of being a little bit back to normal, even if we can't do that with everyone we know at all times. But I do want to caution us against, throwing caution to the wind too quickly, because if we continue at some of the more, extensive precautions through the summer, we actually have a better chance of really getting a hold and keeping our numbers quite low for a long time and not seeing the peaks resume and having to go back to some of the more restrictive precautions that we've had to take over the last year. So it sort of feels, it's like if you're running a race, as you can see, the finish line is not the time to let up, it's the time to keep your pace consistent so that you actually can finish and be successful. And so hopefully though that a little bit of the alleviation of the pressure and resumption of some of those things that, we're really missing out, especially with the people closest to us for folks who have been really, engaging in the precautions, will at least feel good and will soothe our souls and meet our human need to be socially connected with one another and physically connected with one another, which we understand is harmful when we don't have that in the ways that we're accustomed to.
Mm-hmm. Yeah. And, I know it's a very, very difficult question to ask or to answer, what will this summer look like? I'm wondering, maybe Dr. Garcia, if you could talk a little bit about, what are the conversations you're having with other experts right now? For me, having interviewed a lot of doctors throughout the pandemic, this sort of ongoing conversation is a conversation of what we don't know, right? Just sort of an inventory of all the things we don't know yet. And I'm wondering, is that still the conversation that you're having with your peers?
Yes, and I think so. As I said, you know, with Dr. Anthony Fauci announcing that by May 1st, we really should have this available, not for everyone, but for most individuals. And having the ability to be with family members during the summer, attending, you know, services, religious, visiting family is important. And that's why the vaccination is key, and speaking it to it and educating individuals, but having those once again mindful, respectful conversations in terms of, you know, why should we do this? You know, it's because we want to be back together. We want to, you know, speak to our neighbors, spend time with our family. And so there are many services that, you know, are still available to us now and are safe. So, for example, we're able to visit our physicians, we're able to visit our dentists, we're able to visit our veterinarians. You know, our animals are important as well. And there's so many resources right now that are taking all of these precautions into place. So there are safe things that we are able to do at this time. And so I think with the rollout, especially with the news in California, the state of California, I am optimistic that we will reach a much larger part of our or communities.
Mm-hmm, mm-hmm. You touched on, I think, sort of the mental health toll of the pandemic. And I'm wondering if maybe Khadija or anyone else can talk a little bit about what sort of the how would you describe the mental health toll of the pandemic? And, you know, have you found good solutions or good tools for people to sort of recover what they may have lost over the last year?
I think I can speak a little bit from my experience. I started medical school during a pandemic, and I wasn't able to really interact with my class or get to know people in my class. And it was a little isolating at first, and it definitely affected us a lot. But, you know, with time, you learn to like find friends and make those small connections and maintain those small connections, and also do activities like play tennis. I know every single time you go outside, there is a risk calculation you have to make, but I think we also need to take our mental health and our social health into account when we are making these decisions, but also absolutely staying safe. And I think one thing that really makes being a vaccination center so impactful for me is that I will see patients come in and then they will get their vaccine and they will just like almost cry because they were so overwhelmed by what this means for them, what this means in terms of what they can do in the future. And it's been an amazing process to be part of. It's been an amazing opportunity. I just want people to know, like, there is definitely light at the end of the tunnel. We are heading towards a direction where we can all hopefully return back to normal and start seeing the people we love and doing the activities we love.
Excellent. Shante, I was wondering if you can also add to this as well.
Yeah, I just kind of want to add that, you know, with the mental health, we also see so much with our youth. And so some of the conversations about kids going back to school and the safety of that kind of also plays into their mental health of being isolated from, you know, people. I do know there's a lot of organizations that have still worked really hard to create even a virtual gathering, pop-ups, organized events, just to be able to connect with the youth, because that's one of the biggest things when the pandemic helped is they were cut off and there wasn't a lot that was going on yet to get them connected and reunited. And I think when we're talking about mental health, we also have to start with our younger people, because that's what's really being affected. We look at some of the suicide that's happened over this time frame, and the age of the children that age of the people that are affected, our youth are one of the highest. So we want to definitely look at what are those things we're doing during this pandemic, even if they're not in person yet, to support the mental health of our youth and our families. And we look at our families' mental health as far as, you know, I lost my job, I'm a main provider. What are the things we're putting in effect? I know Dr. COFER talked a little bit earlier about that dynamic, right? We're not providing income for our families and our communities that need it the most. But we have to look at what are we going to do as a community to support those families to continue to support their mental health as well.
Yeah, absolutely. I'm glad you brought up, you know, schools and the struggles of our youth. You know, we got a question from Facebook. They asked, I just had a question about when children under 16 would be able to get the vaccine. Dr. COFER, I was wondering if you could maybe take on this question.
Sure. What happened in the initial trial was that it was mostly adults, with the exception of the Pfizer trial, which did include kids 16 to 18. And so their authorization right now does include those ages. But because of the tier system that we have in terms of eligibility, most people in the 16 and 17 year age range have not been vaccinated yet. But once we lower the tiers, as we've been talking about during this time, then at least some 16-year-olds and 17-year-olds will be able to be immunized. For those under 16, right now, Pfizer and Moderna have a trial that's underway at this moment for kids 12 to 18 for Moderna and to 16 for Pfizer. And so we anticipate having results from those two trials by late summer. So it will be a while before eligibility would open up if they get emergency authorization to begin to immunize kids. And that would only be, again, 12 and up. So we would still have those kids under 12 not being included yet in both study as well as plans to roll out vaccine.
Thank you for sharing that. One thing I was wondering if maybe one of y'all can tackle is a question I have seen come up sometimes is this feeling that maybe it's unethical for me to get the vaccine. So for example, maybe you signed up for a no waste dose, right? So you're under 65, you're not an essential worker, but you get a call that says in the next 30 minutes, you have a shot. I'm wondering if one of you guys can tackle this question, that feeling of guilt some people might have about getting a shot, even if it's, not quote unquote their turn.
Yeah, I mean, it certainly is complicated, I would say. I mean, at this point, we're really trying to get to, a place of herd immunity is the goal. So I think, the feeling guilty isn't going to really help anyone, especially if the alternative is we're throwing, doses in the trash because we can't use them anymore. So I would say, if there are lots of things to keep us up at night in terms of, oppression and, challenges in the world. And if you happen to get one of the doses of vaccine because, they were going to be spoiled otherwise, that would not be one of the things that I would let keep you up at night.
Excellent. Shante, could you add a little bit to this?
Yeah. Also, you have to understand, when the tiers came out, some parts of the tiers that just didn't sit well with me either, right? Because the people who are getting tested when we're starting at 65, you're not starting with the workforce people who are actually in the field and exposed more than anyone else, right? So when we started with this tier and the name and the numbers of the people who can get them and the age that they can qualify for them, that was a little already out of order because, the people who are in this field, I worked in the community and my tier didn't come up first, right? And I'm working one-on-one with people versus people who are just virtually working with people and they came above me. So, those are things we also have to accept. No, I will not lose sleep if I got out of order for getting my testing either, because it's really important that we make sure this is equitable, right? And think about who really needs this vaccine first.
Mm-hmm. Mm-hmm. And Dr. Garcia?
Certainly. And I think about those in terms of social inequalities, individuals that are homeless. We have so many teens and young people, individuals that are incarcerated and institutionalized. So those individuals also should have access to the vaccine. And I think these are populations and communities we often forget about, but they are part of our community. They're our family. They are our friends. So, young individuals, we often forget about them. LGBTQ communities as well, kids that are at home right now and, are at risk coming out. And so I think about also individuals that are in violent homes, young teens that may leave. And so these communities, are important. So.
I'm glad you raised that. And also, Shante, I'm glad you raised the point about the tier system. I mean, it has been an evolving set of rules for who is eligible. I remember when there was, three, there was a phase 1A, 1B, 1C, mostly based on jobs. And then we moved into age-based priority. Now we're sort of in a split where, depending on the county you're in, you may or may not be eligible. One thing I wanted to touch on, our next question from Arthur Hernandez in YOLO, and it's sort of related to what we were just talking about, but he said, how do proponents of racial equity make the most of this moment? I think, as you all have pointed out, the pandemics have been sort of defined by disparities. I'd love to have everyone answer this question, but maybe we can start with Dr. Garcia.
Absolutely. And I think every person counts. So we really need to count. We need to understand the data. We have communities that are keeping track of individuals, but not at the level that we should be. We need to find out what groups of individuals are at highest risk. And this all came to light. For example, I was recently listening to a webinar, data that came out of Boston. It truly, that's how we found out that it was the Black and Brown communities as well, individuals in high-risk jobs. You know, these are essential jobs. So it's important for us to quantify, because they're not numbers, they're human beings. They're our mothers, our fathers, our brothers, sisters, they're our best friends or partners. So we need to have a data system that continues beyond COVID-19.
Mm-hmm, mm-hmm. Khadija, maybe you could also answer this as well.
So I'm part of SHIFA, which is one of 11 student-run clinics at UC Davis, and each student-run clinic has a population that focuses on. Like SHIFA focuses on Middle Eastern and Asian populations, and then we have other clinics that focus on the Hispanic population within Sacramento, and then the Hmong community within Sacramento. And at the student-run clinics, in order to reach these populations that aren't being reached in Sacramento and California overall, we've been collaborating, and we've been having these clinics that have connections within the community reach out to their communities. And I think we've seen great turnout so far. A lot of the populations that we have been able to vaccinate haven't been able to get their vaccines in other locations, even though they are eligible. That was a little frustrating and disappointing at first, because it seemed like the people who were eligible, who needed the vaccine, who weren't necessarily as connected, weren't able to get it. And I also know, in terms of like mass vax, which is keeping track of which ethnicities or races of people who are getting the vaccine, the categorizations are really broad. So it's like white, Hispanic, Asian, and Black. And I don't think that's catching all of the population or giving us systems to be able to really understand health inequity issues that are occurring within vaccine allocation.
Yeah, absolutely. And I think that sort of disaggregated data is so helpful, but you're right, it's kind of lacking. You know, for me, it's sort of two glaring issues I've seen is, you know, one, when you look at Sacramento County, for example, who's getting the vaccine, 1 in 4 of those doses, we don't know the race or ethnicity of the individual, right? There's a huge gap in our understanding of who's getting doses right now. And another thing, just to add on to what Dr. Garcia was saying, you know, you can even look, you know, the CDC is putting out reports showing that it's not just, you know, manufacturing workers who are more likely to get COVID-19. It is the workers at these manufacturing plants who are workers of color who are more likely to be seriously ill or die. Even though everyone, you know, it's even if you look at the whole spectrum of people who work in the industry. I'm wondering, maybe Dr. COFER, if maybe you can also add to this. The question from Arthur was, how do proponents of racial equity make the most of this moment?
Yeah, I'm going to take the long kind of view on this, which is this moment has, as I said before, laid bare some of the things that have always been happening. And so I think it's also our opportunity to say, if we can reach beyond just COVID-19 and actually address some of these things, we'd be in a much better position. One of our challenges as a society is that we do the thing that if we were, you know, financial, oversight for, you know, or financial planners, we would tell people to never do, which is that we never plan for the future. We're always playing, you know, we're always kind of spending every single cent we have on everything that's happening right now. And so part of what we saw is that our public health infrastructure had never recovered from the 2008 recession and from decisions even before then. So here we are layering additional work on top of an infrastructure that just wasn't prepared for that. You know, we're seeing that we never have taken time to actually dig deep and figure out, what does it look like to be able to right historic wrong? wrongs, right? We got rid of redlining, which was, housing segregation over 50 years ago, and we still see the exact same people living in the exact same communities. Gentrification notwithstanding, we still see the same people living in communities and dealing with the same housing issues and the same level of housing segregation we had 50 years ago, but we got rid of the policy. So the question becomes, what do we do beyond just causing harm and then saying, okay, we'll stop causing harm now? What are we doing to repair? And I think that's the moment here when it comes to racial equity, is to say, what are we going to do beyond just responding to COVID, but actually repairing the conditions that predated COVID and that have been exacerbated by COVID, so that in the future we can solve some different problems, because the disparities are obvious. We know about them. We've known about them for years, and we could have predicted them. If somebody had told me in 2018, you're going to have a global pandemic in 2020, who do you think is going to die most? And had offered me, all the world's wealth, I'd be the wealthiest person in the world, because we all could have predicted this. Everyone on this panel could have predicted it. And so the question then becomes, what are we doing structurally to take advantage of this moment when we're all seeing it? Are we really going to, in the aftermath of a pandemic, when so many people lost their jobs, going to continue to bury our heads in the sand and say, yes, it makes good sense to us that your healthcare is tied to your job? Does that make sense to anybody anymore? Because it never made sense to me, but it makes even less sense to me now that we've dealt with a pandemic where people lost their jobs, right? And so I think these are some of the deep structural issues that we have to ask ourselves and that we have to get to. Otherwise, we're going to be doing this again in 20 years, having the same conversations and the same outcomes. But this is our opportunity to say, no mas, we don't want to do this anymore. I want to get off this roller coaster and I want to do something else.
Mm-hmm, mm-hmm. No, thank you for sharing that. And I think also, a lot of people would have been very surprised even a few years ago at the idea of local and state governments just giving checks to people who were struggling, right? The idea that you've got thousands and thousands of people who are struggling to make their rent payments, just giving them a check to keep them afloat. I think some people have said regularly through the pandemic, well, what if we made sure that people were not already so vulnerable to being evicted in the first place? SHANTE, I'm wondering, you're working with a lot of these, with a lot of people just like on the ground. Even Thursday today, you have a test site right now. I'm wondering, what do you see as sort of, how would someone make the most of this moment, in terms of racial equity?
So one of the biggest things that I've realized during this season is that COVID brought out a lot of disparities that we have been experiencing and brought it in front of people's faces, right? And so right now, being in part of the community, we're able to take that information, share a little bit more, and figure out how we can do better next time, right? How can we be better for our future? Because right now in our community, when we're seeing that our families are struggling with housing, but we're learning about all these things during the pandemic of housing support that was already in place, how do we now take that information to further our education to our families in the community to ensure they don't struggle like this no more, right? Who do we connect with? We don't need a pandemic to have a solution, right? We needed this solution way back when they were struggling beforehand. So now being in these communities, those are the things that we're going to be taking, right? We're going to take this education, take these tools that were provided that we learned during the pandemic, even though these are problems we had prior to, and start working with our communities to support our Black and Brown families.
Mm-hmm. I would like to ask, and this is kind of a tough question, but how do people keep institutions accountable to some of the things that you're describing, right? It's so easy, I think, for a massive cataclysmic event to sort of energize a lot of people. And then a few months down the road, a lot of those proposals or promises sort of get pushed to the wayside. How do you sort of suggest people keep elected officials and institutions accountable? Maybe we can start with Dr. COFER.
Sure. I would say organize, right? I mean, like we, getting together with other people who are interested in this and are going to be vigilant. I want to lift up a few things that are happening, especially locally. One is, there's the People's Budget Sacramento and an offshoot of that, which was the Cares for the People Coalition, and got together and said, where are these CARES Act dollars going, and how do we make sure that they're going in the right place? And I think that continuing to be vigilant about the implementation beyond just the policies, but then what comes after the money is allocated to, our cities and counties? Where does it go? How is it spent? Is it going in the right place? I mean, it's a great way for people to get involved. And I know budgets sometimes feel overwhelming. People, a lot of people really hate math and find money to be challenging, but it's one of the places where we have the biggest impact if we're thinking about organizing. In thinking about organizing, Public Health Advocates is part of a new initiative called, California COVID Justice, and it's about response, recovery, and repair. And so really looking beyond just the pandemic, but what does it look like to repair the harm that's been done, and what are some of those policy changes that we need to champion now so that we're in a better position in the future? And then there's the idea I always talk about, the 70-30 kind of rule, which is what would it look like if we actually expended 30% of our energy, our time, our resources, and maybe even in some instances our budgets to be able to look forward thinking, right? Would we be in the process of being on a countdown for climate change? Would we constantly having to find a way to mobilize resources when something happens? Or would we have already had things in place when we needed to activate them? I think about the early days when we shut down schools. And my first question was not, is this a bad idea, right? Because I understand public health, I understand infection control, I'm an epidemiologist. But my first question was, there are kids throughout our district who rely on those schools for food every day. Who is going to feed them? There are kids who are relying on those schools for safety and for social services. Who is going to provide that? My questions were public health questions. They weren't infection control questions. That part I got, but it was what systems do we have in place so we're not scrambling when something happens, because something inevitably will happen. And so I think that's part of what we need to reorient ourselves to, and we really need to push our elected officials and our leadership to be saying, what are we planning for down the road? Because we can't always, some bells can't be unrung. We can't raise the 500,000 people we've lost nationwide from the dead. So what could we have done better next time so we don't lose so many people?
Mm-hmm, mm-hmm. Thank you for sharing that. SHANTE, I wanted to pass this on to you as well.
Yes, I just wanted to add on there, during this pandemic, there are a lot of people who have moved to tables that they normally didn't sit at. And so taking the opportunity now that you're at that table to stay at that table, because now that you have that experience, you can now continue to share and push forward, kind of how Dr. COFER is sharing that. I know for myself personally, there's tables I have been at that I've never been at before. But now that I'm at that table and I hear the things and the things that they're trying to apply, I can fight for my community because I know what you can do and what you should do.
Thank you. And Dr. Garcia?
And I agree with SHANTE as well as Khadijah and, Dr. COFER. These communities have to be at the table. They have to be part of the decision-making process, and they have to be part of deciding where that investment should go in the communities. They know the communities. They're on the ground, and they are members there, so they should be. And so having individuals inform at all stages, not right in the middle of a pandemic, but prior, so that yes, going forward, you make a 5-year plan or a 10-year plan. But these, key stakeholders, the community, these are a rich resource for us. And so they should now, not just during COVID-19, but, as our panelists said, for future epidemics and future pandemics. This is not the last one. And as I mentioned earlier, we do have smaller epidemics that are ongoing and do impact our communities, such as, hypertension, type 2 diabetes, respiratory illnesses. And so these are outcomes that are preventable. And so these communities should be a part of that process.
Mm-hmm, mm-hmm. Thank you so much for sharing that. And I do wonder, sort of in this time of Zoom and Skype calls, I wonder if we'll see engagement or civic engagement change and become a little bit easier for people who might not otherwise have had the time to necessarily show up to a city council meeting at 6 p.m. on a Tuesday prior. I wanted to ask, this will be my last question. We received a lot of questions, and we'll check Facebook too if there's any more. But a lot of questions from readers we could not get to today. I would like to ask you all how others should stay informed. what are the best sources of information on the virus, on restrictions, safety recommendations? Maybe this is from medical universities or government websites. I'd love to get your sort of insight on who you're following to ensure that you're sort of up to date. And we can start with maybe Khadija.
I think for me, what I've been mostly following is the CDC guidelines and also the county. So a lot of the things that we used for clinic to decide who would be getting vaccinated, how would be doing the procedures, came directly from the CDC as well as the county. And they're a really good resource for figuring out which tiers will open up, when they will open up, as well as future plans within Sacramento.
Excellent. Dr. Garcia?
One of my favorite websites is covid19.ca.gov. And so it's a wonderful resource. It really gives you up-to-date information. And I think it's really important. We have so many community members that are a part of this process, as well. UC Davis, both the health system, the School of Medicine and veterinary medicine, we have amazing scientists and researchers. And I would also concur, with Khadija, the CDC. It's a wonderful website. And I think it really places complex topics in understandable language. So I understand it, and it's nice to be able to share it with individuals, because it's also available in several languages, and that's important. And so that's been a really nice change to have all of these communities involved.
Yeah, I feel like the language thing it's sort of like vitally important. I know at the beginning of the pandemic, especially like in regards to information about testing, for example, not having those translations was really, really detrimental to proactive outreach. That's great. SHANTE, what about you? What are some of the places that you're getting your information from?
So being able to be at a lot of different tables, of course, we follow the CDC guidelines at the community center, and we rely on them to be able to know when we can do certain things with our community. But I definitely follow SAC Public Health as well, because they give us a lot of insight, and we do meet with them along with SAC County guidelines. Or so we go on the SAC County site just to get some more information as well.
Great. And Dr. Cofer?
All of the resources that have been shared already are ones that I think are really important and that I go to frequently. I would say, the only one that I would just want to lift up again is that there is a phone number. And so for those of you who are doing outreach and are talking to folks who, I had the pleasure of being on a Zoom with my 70 to 90-year-old relatives the other day, and it took us an hour just to get everybody on, because this is not their wheelhouse. So I definitely, recognize that having a phone number, and some of them we just said, call in, and here's the number, is really helpful. And so 916-875-2400 for those in Sac County. If you have questions about, COVID and vaccines and all of that, you can call that number and you can speak to someone and actually get information that way without having to navigate the internet. So again, that's 916-875-2400. So please, share that with people for whom that may be a better way to be able to get information and access.
Excellent. And thank you so much for sharing that again. I can't tell you the number of times I have had an email or voicemail from someone who read a COVID story in the Sacramento Bee newspaper, the physical copy, and called me up and asked, basic questions about the vaccine and where they can get it. So that's great that that's available. I'd like to go around one last time and just ask, is there any last sort of final thoughts that you wanted to make sure you imparted to people as we head into these spring and summer months? I guess we can start backwards. So Dr. Cofer, we'll start with you.
I think I would say to everybody, just please continue your precautions, wear a mask, avoiding especially the indoor gatherings, just continuing doing what you've been doing for a while. We are so close to being able to potentially permanently loosen some of those restrictions. And so now is not the time to let up. I would also say that, if you have questions about the vaccine, that's good. And that's okay. You should have lots of questions. We encourage questions. Please ask. And please don't feel, afraid or ashamed. And people who really, care about you will respect your decision making. My goal, and I think a lot of our public health goal, is that you make informed decisions, emphasis on the informed. And so we really want to provide you with information so that you can make your own decisions, because we do believe in autonomy, and we believe that people should be able to opt in, and consent is sexy. It's something that we want everyone to have. And so we want you to feel comfortable with all of your healthcare decisions. And so that's what I would say as we're going in is let's be respectful of one another. Let's answer questions, and let's continue to engage in our precautions.
Thank you. Shante.
Yes, definitely. I concur. One of the biggest things, even those who are getting vaccinated, it is still guided that you continue to practice safe precautions, wear your mask, wash your hands regularly, and social distance. And so I just urge people to continue that. I understand that we hear things opening back up in different places, but we have to be diligent in the work that we're doing here in California, and stick with what California is guideline us to do at this moment. So I just say continue to be safe and protect yourself and your family.
Thank you so much. Dr. Garcia.
One last note is that I know that it's been a very difficult and challenging year, and certainly tragic. Most of us have lost a loved one, and it's in particular tragic when you know that it is preventable. So going forward, I'm looking to see more investment in our communities, in our departments of health, our community-based organizations, and truly to share with one another that these vaccines are safe and they are efficacious, and just have that conversation so that, as others have said, it is normal to ask questions. And I've asked those as well, and I've answered family members. So just keep in touch with family, and it's a very, very important time for us all.
Thank you so much. And Khadija?
I think I just wanted to add that I know it's been a long year for everyone, and we've all been through a lot, but I think we're getting close to a good place. And if we continue supporting our healthcare workers and asking these questions about the vaccine and being curious and being informed by the right people, I really think we'll do well as a county overall, and we'll do well as California overall. And I'm excited for the future and optimistic.
Great. Thank you so much for sharing. Yeah, for me, my sort of takeaway from this has been staying curious, keep asking questions. There aren't always clear, precise answers right now, but we're learning more every day. So that concludes our Q&A discussion for today. Thank you so much to our panelists who took time out of their very, very busy day to share their thoughts. And thank you so much to the many, many readers who submitted questions. I'm sorry we could not get to all of them, but we at the Bee will continue to report on this story, and oftentimes with the expertise and guidance of the people who were panelists today. Like I said at the top of the event, these kinds of events would not be possible without the support of our subscribers and readers. You can support panel discussions like this by subscribing to the Sacramento Bee at sacbee.com/subscribe. And you can also subscribe to our free newsletter at sacbee.com/equitylab-newsletter. For up-to-date information about the coronavirus, feel free to follow us at thesacbee.com. You can also find us on Twitter and Facebook, Instagram. Thank you so much again to all of our panelists and to everyone who's watching, and stay safe, everybody. Thank you so much.